project that we held with CPAC as part of the Northwest Territories Health and Social Services Authority was aimed at really creating and developing with the community for the community a colorectal cancer screening awareness campaign and organized cancer screening program that would hopefully lead eventually to the increase in colorectal cancer screening participation rates. We really wanted to focus on identifying who were the key stakeholders in our target region, which was the Beaufort Delta, and working with those community stakeholders and partners to create a project that would be sustainable, ongoing, to meet the needs of the community for the community. Target groups that we were hoping to engage with as part of this project were community stakeholders at the forefront of our project. So including the healthcare providers that were on the front line previously delivering these programs. So your community health nurses, the endoscopy team in Inuvik, our community health representatives, all of which who have a very trusted relationship with community members from a healthcare delivery perspective. We also, of course, wanted to engage with stakeholder groups that are very well respected and hold very positive relationships with community members, including the Inuvialuit Regional Corporation, the Gwich'in Tribal Council, the senior leadership in the Beaufort Delta region, and then the target population for colorectal cancer screening. So the creation of our community awareness campaign and the resources and materials that we developed as a result of this project were really meant to engage the community at a community level. So again, identifying community champions as identified by the community and really figuring out our best strategies and interventions to meet those individuals in our most rural and remote region. From those meetings, we were really able to talk about historical barriers and challenges to colorectal cancer screening in the community. And those particular stakeholder groups who are key knowledge holders were able to convey to us some strategies or some interventions that may work to really promote the program and really improve awareness around the benefits of screening and early detection. From those meetings, have them identify some individuals in the individual communities who would really be key community champions. So thinking back to the community of Paulatuk in particular, the Inuvialuit Regional Corporation was really able to identify that the mayor, Ray Rubin, would be a really great contact for us. So we were able to reach out to the mayor, and he was very supportive of our screening program and the community awareness campaign and development. He was able to go on the local radio station and promote our program, as well as offer some quotes that we could use on our resource materials, really to start to build upon that relationship with community members and those eligible individuals that we were trying to connect with as our target population. Conversations that we had with those community champions and partners really informed what strategies we developed. So one of the things that was really important was taking into consideration factors such as technology deprivation, language and literacy barriers, and the vast geography of the region. From there, we were able to work with those partners to develop resources that we felt would hopefully be culturally appropriate and really reach those eligible populations at a local level. So they were able to help us really focus on the importance of translation, ensuring that all of our screening posters that were being promoted around the community were translated into all 11 official Indigenous languages of the Northwest Territories. We were also, from those conversations, able to work towards redeveloping our FIT instructions that came as a part of the FIT kit, and really shift towards a more pictograph-based instruction format. That the intention behind that being that it would help to mitigate the language and literacy barriers across the region and really promote a better understanding of how they would be completing that FIT at home. Most of our resources that we developed were co-developed with our stakeholders in the communities. And then we were very privileged to have the ability to have these resources reviewed by various partners from a culturally appropriate perspective. We were very thankful that they were able to provide their perspective and feedback on the appropriateness of those materials and ensured that they really were going to meet our target population's needs. The other partner that we worked very closely with throughout this project was the community health representatives. So in the instance of this project, their primary role was really to help support awareness and promotion around the use of a FIT kit for screening, as well as the benefits of early detection. In the Northwest Territories, historically, we are diagnosing our colorectal cancer patients in the later stages. Oftentimes 50% of our cases are diagnosed in late stage. So this was an opportunity for the CHRs to really engage with their community members and promote the benefits of colorectal cancer screening and early detection. Our original community engagement strategy really revolved around in-person relationship building. Unfortunately, as we launched the first two communities, we did enter into the pandemic that has now remained ongoing. As a result of that, we had some inter-territory travel restrictions, and we really had to make sure that we were meeting the communities where they were. One of the concerns was the introduction of COVID-19 into rural and remote communities in our northernmost parts of the territory. So we had to be very mindful that we were creating an engagement strategy that would not cause any undue stress or fear at a community level. So we were moving away from the idea of in-person community engagement and community feasts, which we know historically are very successful interventions to promoting community awareness, and instead had to shift to virtual support and really drawing on our relationships with our partners at a local level. I'd have to say that those local stakeholders and partners really stepped up in lieu of us being able to travel there. And we're still going on their local radio stations and talking about the program. They were posting social media posts that were promoting the benefits of screening and early detection, and every opportunity that they had engaging with the frontline target population. One of the resources that was supplied to our project team by One World as a partner was the Moving Towards a Stronger Future, an Aboriginal resource guide for community development. And what really stuck out to our project team in reviewing that resource was, creating a project with the community for the community. One of our primary focuses was wanting to make sure that the materials that we deployed were culturally appropriate and safe, and that the interventions that we were using to distribute the FIT kits across the territory and the means that we were using to collect formalized feedback at the end of that was a sustainable process. From our interactions with the community health representatives and the nurses in charge at a local level, we wanted to ensure that our communication with those local healthcare providers was as clear as possible to mitigate some of the barriers that exist with a high level of locum healthcare providers, often coming in and out of the territory and not always having a consistent job share partner. We developed a colorectal cancer screening resource binder. So this resource binder was intended to really lay out why colorectal cancer screening was important, who our target population was, and what everybody's responsibility and role in the deployment of this program was. If we can't travel to the community to do this in-person engagement, how are we going to collect the formalized feedback from our target population? And what we landed on was hiring two facilitators who were exceptionally helpful and had a previously existing relationship with our community health representatives, and working with us and the CHRs to reach out to individuals who had been mailed a FIT kit and asked to complete it as a part of our program. One of the pieces that we used to identify individuals who would be interested in providing this formalized feedback through a one-on-one telephone interview platform was offering a grocery store incentive. So we did offer a $50 gift card to the local grocery stores to anybody who is interested in being a part of that one-on-one telephone interview with our facilitators. We can certainly apply lessons learned to the future rollout of our organized colorectal cancer screening program. The intention is that the lessons learned from this program will help inform the rollout as this program expands across the Northwest Territories. Once that's fully implemented, it will be the first ever organized cancer screening program in the Northwest Territories, which is very exciting. One thing that I did want to highlight was the impact that this project has had on our overall colorectal cancer screening rates in the Beaufort Delta. Historically, we have seen low rates in that particular region, around 8% participation rates prior to the implementation of this project. As a result of our targeted engagement and community awareness campaigns that were created in partnership with our stakeholders and community members, we have seen a significant increase in our colorectal cancer screening participation rates. Rates in the Beaufort Delta overall have doubled, and we are now seeing tripling and even quadrupling participation rates in some of our communities, upwards of 43%, which is extremely exciting to see. And as a project team, we're really hoping that that then translates to improved outcomes for the residents of the Beaufort Delta. One recommendation that I would have for other partners who are beginning works around engaging with a similar target population, I would always suggest to pull in and identify those community stakeholders as early in the process as possible. Again, going back to what our project hinged on, which was developing a project and a program for the community, but most importantly with the community, wanting to make sure that we as a project team had an understanding of barriers and opportunities, and the community stakeholders are really the ones who are able to identify the strengths in the community that we had the opportunity to build off of, and also identify some potential barriers or some challenges that we could work with those stakeholders and the frontline providers then to mitigate as we made our way through this project planning and implementation process.